As we age, our health needs evolve from physical health to mental well-being. However, recent data shows that older adults who have good relationships with their primary care physicians, particularly those who practice in value-based care settings, may see a significant difference in navigating these changes and quality of life.
But in what ways specifically? Dr. Robert Zorowitz, an expert in geriatric medicine and regional vice president of health services for Humana, joins us with details. Welcome to the show, Dr.
Hi.
Zorowitz. Thanks for joining us.
My pleasure. Good to be here.
Yes. So could you start by maybe explaining why primary care is so important for older adults?
I'd be glad to. As we age, we get more complex. We have more issues with physical health, mental health, the ability to move around and do the things that are important to us, social context, and a primary care physician is really important in establishing a kind of relationship to understand not only what's important to mental health and what medications we're on, and what kind of physical things are important to us, and what is really mattering most to us in terms of maintaining quality of life.
Yes, certainly quality of life is a big deal. So what are those maybe specific benefits seniors can expect from regular primary care visits?
Well, regular primary care visits provide those regular checkups, but also check-ins. How are you doing? How are you feeling? How's that medication that you started? Are you having side effects? Are you able to move like you want to move? You know, let's check in and understand how your mental health, your physical health, but what matters most to you. And let's talk about preventive screenings and what we need to do in order to keep you healthy, not only now, but in the future.
Yeah, and you mentioned screenings there, and I'm glad you did so. So what are some of the key screenings and services you might recommend for patients, particularly those who are 65 and older?
Sure. Well, you know, as we get older, I would still always recommend diet and exercise. That never goes away, those lifestyle things. But also things like what kind of vaccinations are important to prevent communicable diseases? How about screening for very common disorders such as high blood pressure, diabetes, cardiovascular disease, a variety of cancers, of course, and putting all of this together in a personalized package that really focuses on the individual's needs is important.
Certainly.
Yeah, absolutely. And Dr. Zorowitz, how does this kind of differ from maybe a traditional fee-for-service care, and why would you say it's beneficial for older adults?
Well, traditional fee-for-service care is a matter of paying per visit, whereas value-based care is paying for the quality of care and outcomes rather than simply the quantity of visits. And that allows for more time spent with the individual patient, understanding what matters most, being able to review all those medications and optimize them, and also spending more time with education and counseling, understanding a personalized care plan for prevention and screening, and having that trust and communication built up so when the chips are down, you're not feeling so well, you have a physician and a care team that really understands your needs and can help you get back on your feet and feeling well again.
Absolutely. So for those maybe watching who don't have a primary care clinician or are interested in switching, how do they go about finding one?
The insurance carrier is generally the first place to go. The membership card will usually have a number on the back that provides someone that can help guide to a primary care provider that's both within network and within your geographic area. For Humana, that's certainly the case. Most insurance carriers will also have a website to go to with a search function. For Humana members, that's humana.com. But again, most insurance carriers will have a similar search function.
Certainly.
Great.
Yes.
Yeah. Well, thank you so much for joining us. And that
Thank you.
website is the place to go for more info?
Yes, it is.
Yeah, humana.com. There it is. Thank you, Dr.
Thank you
Zorowitz.
so
We appreciate
much.
your time.
Thank you.
Yes. Yeah.